Hi, my name is Ashley, and today we are going to do an assessment of the nervous system. This can begin with just talking to your patient, checking for a level of consciousness. You can also use the mini mental, which could be a good tool to use to check for orientation. So I would ask him his name, date of birth, where he is, what date it is, and that would all tell me that he is alert and oriented to himself and place, or times 3. I'm going to begin with the cranial nerves. So we're going to start with the olfactory nerve, and we're going to assess for smell. I'm going to have you block one of your nares and breathe in. Okay, and that shows that the patient's nares is patent. And I will then also have you do that again and close your eyes. And I'm going to have you smell something, and you're going to let me know what the scent is.
Lavender.
Okay, so that tells me that his olfactory nerve is intact and he's able to identify the aroma. We're then going to move on to the optic nerve, and you would use the Snellen chart, which we've used in previous videos, to check the patient's vision for far distance. So today we're going to check the left and right for acuity, and I will have you read a sentence right here. And if you could just read the top of this right here.
Motor system.
Okay, so that tells me that his near vision is intact. I'm then going to do what we call a confrontation test. So I'll have you cover one eye, and you let me know if you can see my wiggling fingers.
Yep.
Alrighty, so this patient's peripheral vision is intact using the confrontation method. Okay, so next we're going to test the 3rd, 4th, and 6th cranial nerve, which would be the oculomotor, the trochlear, and the abducens nerve. They all coincide together. So with this, I'm going to use a light and check the pupils for accommodation and reaction to light. So I'm just going to shine this light in each one of your eyes. Okay. All right, so when I did that, your opposite eye expanded, the pupil. So both eyes are, both pupils are equal, round, reactive to light. And to check the accommodation, I will ask you, I'm going to mark a big H, and I'm just going to have you follow my finger. Okay, and I will also have you touch your nose. And okay, so you are, there was no nystagmus noted when we checked for accommodation, and his pupils are equal, round, reactive to light in accommodation. We're next going to move on to the trigeminal nerve, starting with strength. I'm going to palpate the temporal and masseter muscle while I have the patient clench down on his jaw. So clench down, okay, and clench down. Okay, so that was +5 in both. I'm then going to check for sensation. So I'm going to use this paper clip, and this is checking for both sharp and dull. So I'm going to show you what sharp feels like and then what dull feels like. And I want you to identify which sensation you feel. So, which sensation do you feel? Sharp or dull?
Dull.
Okay. And which sensation do you feel?
Oh, this is dull.
Okay. Now you can identify that that's sharp.
Yeah.
Okay. So the trigeminal nerve is intact, and the patient's able to identify both sharp and dull sensations. We're then going to move on to cranial nerve number 7, which is the facial nerve, and we're assessing for symmetry. And I'm going to have you raise your eyebrows up and down, puff your cheeks out, smile, showing teeth, and purse your lips. Okay, and the patient has facial symmetry throughout. Cranial nerve number 8 is acoustic. So we have completed this in a previous ENT video using the tuning fork, which the patient's acoustic cranial nerves are intact. 9 and 10 is the glossopharyngeal and vagus nerves, and I'm going to use a light to look in his throat while he says ah. Okay. And I see rise and fall of his soft palate. And to test the vagus nerve, I would use a tongue depressor and check for a gag reflex. The 11th cranial nerve is spinal accessory, which we have completed in the musculoskeletal system video, which this patient has +5 spinal accessory. And the last cranial nerve is hypoglossal, and I'm going to have you stick your tongue out. Okay, and the tongue is midline, intact with no tumors noted. We are then going to move on to the motor system, and I will have to have you stand up for this portion of the assessment. So if you could start from back there and just walk forward. All right, and then turn around and walk back. And then come back to me, but put your heels to your toes in a straight line. Alrighty, so this patient is upright and coordination and gait is steady. I am now going to have you stand up and just bend your knees. Here, let me move this down. And then can you stand on one foot and stand on the other? Alright, great. You are steady. And now we're going to do a test called the pronator drift, so you can stay standing up. I'm going to have you stand up straight with your eyes closed and put your palms out facing up. And you have a negative pronating drift. If this left or right arm started to go like this, that would be a positive pronator drift. We're then going to move on to the Romberg test. So I'm going to ask you to stand up straight like you are, put your arms down by your side, and close your eyes. Okay, and this patient has no swaying, which is a normal finding, and if he was minimally swaying, that would also be a normal finding. I am going to ask you to sit down for the rest of this. And so I'm going to hold my finger out, and you're going to hold your finger out and touch my finger, your finger to my finger, and then back to your nose. Okay, and now with your eyes closed. Great. And this patient is, finger to nose test is intact. What would be abnormal would be indicated called pass pointing, and that would be if the patient's finger missed my finger. Could you then take your heel and bring it from your knee down and drag it down to down your leg, so the opposite leg? Okay. Yep, great. And that was even and coordinated. We are then going to move on to a sensory system. So we're checking for, we're going to start by checking for tactile sensation. I'm going to, again, use my paper clip and check for sensation on the arms, feet, and chest. And you're going to let me know if it's sharp or no.
Sharp. Sharp. Sharp.
Okay, and on the feet.
Oh, sharp.
Okay, so the tactile sensation is intact, and the patient feels all sharp sensations. I am then going to use, check for vibration sensation. So using a tuning fork, I would ask the patient to close his eyes and let me know when the vibration starts and stops. I do not have a tuning fork, so this is how I would perform the test. And sometimes people with diabetic neuropathy may not feel this test. So then I'm going to move on to sterignosis. So I'm going to place a common object in your hand, and I'm going to have you close your eyes. And using one hand, you can feel this object and let me know if you can identify it.
Battery.
Great. So this patient's sterignosis is intact and he's able to feel the object. We are then going to do what's called a graphesthesia. So could I have the palm of your hand, and I'm going to draw to you so that you could read it a number.
Okay.
And if you could let me know what that number is.
3.
Alrighty. So this patient's graphesthesia is intact and he is able to identify the number that is drawn. The last sensation test that we are going to check for is 2-point discrimination. So using my paper clip, I am going to touch it to part of your upper arm. Could you just pull your arm out of your sleeve? It's okay. And I'm going to use the upper arm and ask if the patient feels the sensations in 2 different points. So, do you feel 1 point or 2?
1.
1 point or 2?
1.
1 point or 2?
2.
Okay. So that is about 3 centimeters difference, which is a normal finding. We're then going to move on to deep tendon reflexes. So I would take my reflex hammer and doing the bicep first, you're going to locate the bicep tendon and about right here. And all right, that's intact. Then I'm going to do the tricep tendon. All right, intact. I'm going to then do the brachial and radial tendon. Okay, that's intact, all +2. We're then going to move to the patellar. So I'm just going to need your leg to dangle, but relax. I'll kind of carry the weight of this. Alrighty, +2. And then we're going to move on to the Achilles down at the feet, which is located behind the heel. Okay, +2 and intact. And then we would do a Babinski's test. Typically on children under the age of 2, you would notice a normal finding that the toes curl back, but on a patient that is greater than the age of 2, you should see that the toes curl down. So I would take my an object and I would trace the foot, and the patient's toes should curl down. The last thing we're going to check for is for clonus. And in a patient with +4 deep tendon reflexes, you may notice clonus. In somebody less than that, you would not notice clonus. So I'm just going to dorsiflex the foot and then plantar flex and dorsiflex and plantar flex. And there is no beats of clonus noted.